Welcome back to the Free Clinic's Virtual Days of Giving. Please take a few minutes to watch today's video, bid on our amazing Sunriver Vacation and Wine Wall, and make your donation to the Free Clinic. And remember, if you donate $250 or more, you will be entered for a chance to win an original painting by local artist Janice Tracy. So sit back, relax, and enjoy the video.
I've always had an interest in medicine. One thing that drew me specifically to the Free Clinic was that my mom was uninsured. I've had a lot of experience with free clinics already, translating for her during her medical visits. For a time, it felt like a mystery to me. I wanted to do something to help my mom and understand medicine in general. I started to volunteer here as a Spanish interpreter during the pandemic. They were looking for someone, and I was extremely grateful to take on the role. I'm originally from Guatemala, so I grew up speaking my native language, Spanish. We moved to the US when I was 7 years old. So I understand the culture and a lot of the struggles that our Latino community goes through. Knowing where they are coming from has helped me in this career. My previous job was in the emergency department. I really got to learn a lot about medicine, but I really didn't get to interact as much with the patients. This job really provided me the opportunity to give back, and I feel like I can empathize with the patients because I have a lot of family that has gone through the same experience they have. When someone's first language isn't English, I can tell when they didn't understand anything the doctor said, and we can go back and talk to them in a way that is more understandable. That's the most rewarding thing for me, just giving back to the community. Eventually, I like to do global medicine where you can travel to different parts of the world and serve people that don't have resources. That's my dream job, to go back to my country and serve my people. A lot of our patients are scared to seek medical treatment because they might have misconceptions that they might get in trouble with the government. There's a lot of mistrust and disinformation out there. I've had patients tell me they don't want to go to the emergency room for financial reasons. There's a lot of really sad stories with patients who do not have confidence in the healthcare system. Mental health is really connected with their physical health. A lot of the patients who come here don't realize that one of the reasons their diabetes is so out of control is that they've had difficulty managing their stress levels. One of the ways that fear manifests is that many of them don't want to come to the clinic because they might think they're going to get COVID, or they don't know what kind of care we're going to offer them. Some nights I go home thinking about a patient that maybe we weren't able to get the right medication for because of their documentation status. It makes me sad because I see that person as almost a family member because I come from that background. We do our best to provide them with resources, but sometimes we don't have everything they need. That part has affected me. But I have a good support system. I go to church. I pray for this community, our patients. That's one of the ways I've dealt with the pandemic in general. Having a good support system with my family and my church. We're seeing more patients now after the pandemic started. We're seeing a lot of patients who were covered by the insurance their job provided, and now we're kind of the backup or their last resort. We've seen that for patients that are undocumented and for our documented population. They don't have anything to fall back on. They don't qualify for Medicaid or Medicare. We really are their last hope. Sometimes it feels a little discouraging. I wish we had more resources for these people. A dream of mine would be that our state or our county would have some sort of universal health care for all walks of life, for all patients, regardless of their immigration status. I hope that happens someday and that patients aren't afraid of seeking medical care based solely on where they're from. I feel most fulfilled when we have a patient who has been lost to care and we can help them. Maybe they haven't received treatment for several years out of fear of seeking medical care. They come to the clinic and their labs are out of whack, and we take the time to sit with them and talk about a comprehensive plan for them. You can see the hope in their eyes. Some patients have said, "We are almost like family." They never expected someone to care as much as we do for them.
As we've heard about the free clinic over the past 4 days, it's clear to see the impact it has and continues to have on our community. To donate or learn more, please visit our website at freeclinics.org. Thank you for your support.